Joe, Mental Health, a DPSN video blog.
My name is Joe, or Joey, and I really love coriander.
Tell us about being transgender.
My primary experience of negotiating with health professionals about my mental illness or my state of being is around my gender and whether I want to access healthcare as part of being transgender. I noticed that while some health professionals were quite competent, a lot of it is really unclear for them about how to do it, and so they do rely on things like the DSM, which is like a whole lot of different diagnoses and conditions and criteria to get those diagnoses. And transgender people are still in there under gender dysphoria. You know, the framework they had was based on that we had to be broken, because that's the medical framework, is that you fix things that are broken or you provide a treatment when there's a problem, which in this case doesn't really work or help.
Are there alternatives?
I think some health professionals really have started to grapple with these issues and are talking more about using an informed consent model, which I really support. For example, something like going on hormones. If you were going to do that through an informed consent model, you wouldn't have to have a diagnosis. You would have a conversation, probably several conversations, about what your life was like, what your support systems look like, and then you would also get a lot of information about the risks and the effects and a time frame, and you'd have understandings about what might be reversible, what might not be reversible. It would be explained to you. You would get a chance to ask questions, and the focus would be much more on whether you understand what the medication is going to do and whether you have realistic expectations about it, and much less on evaluating your identity, or are you really a transgender person, or are you just faking it in some weird way. And I think this really shifts the conversation in a really exciting way, because it means that lots of people who don't fit very limited white Western medical model criteria in the DSM could still use this informed consent model to get access to healthcare that can really positively impact your life.
Will that make things easier?
Narratives that we have about transgender people being trapped in the wrong body is an example, and it's kind of like you're meant to know what your end game is, and according to the medical model it should certainly be conforming to all of the expectations of a white middle class binary gendered person. While for some people that might genuinely be their journey, I think the idea that everyone's supposed to know right at the beginning of a process what the end of the process is going to be like, and they have to say, I'm firmly committed to that, that's absolutely what I want, and to not be allowed to have any sense of flexibility or responsiveness doesn't make sense. That's not how we should be doing healthcare. We should be saying, this is an intervention that we can offer you. How does that sound to you? And then you see what it's like. You take that medication for a while. You see how you feel on it. If you don't like it, you stop. And if you do like it, you keep going. I feel like we keep requiring trans people to have a level of certainty about themselves that we don't require other people to have. It just seems kind of ridiculous. Surely it's more simple to talk about support systems and the risks and effects of a medication than expecting a whole lot of people working in health to grapple with the intense nuances and complexities of people trying to evaluate, are you really a transgender person? That sounds way harder. I don't understand. I don't think people should be doing that. On an ethical level, I don't think they should, but also I think their lives would be easier as health professionals if they weren't doing that.